Mark, can you come? Our next presenter is Mr. Mark Stoesz. He's President, Enterprise Solutions, International GE Healthcare, and truly, truly ambassador for global health. Mark.
Thank you, Professor Hedvig, and great to be here with you all this morning. So how does industry get involved, and what can we do differently versus what many of us have experienced in the past, which is effectively just buying a piece of equipment, installing it, and then paying over time, hoping that it stays operational for the next 10, 15 years. And that's really been the way in which in the past we've been operating. What are we doing differently now? Well, I would start by looking at focusing more on integrated partnerships with, whether that's a Ministry of Health or local advanced customers, luminaries, to understand where we need to drive the business to be more successful, not for the business, but for the population of the people that we support. We heard some great discussions about education and training. We see a lot of impact that we need to do from that standpoint. So when we look at how GE Healthcare is looking at LMICs, and I think a lot of other OEMs are doing the same aspect, which is shifting from transactional way of working, moving towards longer-term agreements and looking at procurement models that are not the standard, operating, capital expenditure models, but moving into different types of models from a procurement standpoint. And things that I think are really differentiating is starting to move into how do we support education and training as a partner. And as a partner, what I'm thinking about here, and I'll share some examples, is how do we work on building things like innovation hubs in underserved areas? The example I'll give is in Indonesia, where we've developed the innovation hub where we do education and training in collaboration with societies, in collaboration with luminaries, to make sure that we can build up this strength. So I was very excited to hear this morning from Professor Will about the work that is happening in oncology. From our side, we look more towards diagnostic imaging and what we can actually do to strengthen that and going forward. Additionally, it's around the digital tools. How do we develop tools that simplify the way of working? Of course, we have an prepared staffing availability of people, but how can we actually leverage AI tools and other tools to simplify the way of working together? And ultimately, this is going to lead us to a positive outcome. So this first example on the left is actually a video showing an AI tool for ultrasound. Why is this important? Well, if I take Dr. Fawzi's environment in Egypt, where they've done a very fantastic work in breast cancer earlier detection, where they've reduced just by clinical examinations, reduced by 80% the detection of advanced, or say more advanced cases of disease, stage 3 and stage 4 disease, we've now taken 80% of that out. Why that is important is, what do we do for the next step? So phase 2 of this project is to look at how can we use ultrasound, put it in the hands of non-expert users by leveraging tools like AI. And the example here is an AI tool from another vendor that is one that we're working with Dr. Fawzi and his team to understand whether or not by utilizing this, can we actually downstage even further to be able to address this specific disease. The middle two images, or on the middle and the right side of your screen, are examples of tools that we're looking at in the oncology space. How do we leverage AI tools, make it more use of agentic AI, large language models to assist the oncologist and in your treatment to understand what was the last radiology examination, what was the last blood sample that patient had, and put it into a longitudinal way so that it simplifies. Instead of going and hunting for the last examinations, it automatically pulls this and puts it into a longitudinal space so that it simplifies the way in which you as physicians and therapists can actually understand that data and bring it to life. And this is helping to reduce the overall complexity and operations in your communities if we implement these types of tools. So our goal is in GE Healthcare is to understand how can we deploy this in markets that are underserved and develop these tools. And for doing that, we do need to move away from the standard models of procurement. We need to start to look at it differently. So yes, we can still offer conventional procurement models where we just sell a piece of equipment. But more and more what we see and what we've experienced in these communities is a different desire. The desire has to be around how do you create a true partnership, whether that's a public-private partnership, whether that's through an NGO, whether that's through a government. How do we build this in a smarter way to create this solution that is really around whether that's a managed equipment where we take care of that equipment and keep it up to date over a 20, 30-year period of time, whether we look at a unitary payment approach where you pay one payment that covers all activities around that system and includes other aspects around training. So for treatment for the operators of these equipments, how do we improve that from bringing experience in leadership trainings? How do we look at change management? In some cases, there's a big change that has to happen when we look at bringing new technology into these markets and making sure the efficiency and utilization of that tool is brought to the state-of-the-art way of working. So from the standpoint of what we're looking at doing with respect to support of the community, it's really around bringing together different procurement models that are different than today's standard way of working, bringing into that education and training, looking at that from multiple different fronts, and then also on top of that, looking at how can we as industry support more the education across these parts of the markets that are underserved. So with that, I think I'll hand back to Hedy and we thank you.
Thank you. Thank you, Mark.